What is the importance of recognizing Liver Cancer Awareness Month?
Yes, I love that we have a liver cancer awareness month. It should be every month, but it's because of many of the things that I said. The liver is such an important tool, organ. It does so many things and that are necessary to sustain life. Most people don't think about it because it has such great reserve that you really don't know until your liver is very sick. But there's so many things we can do to take care of our liver. There's so many myths like, oh, only people that drink get with alcohol get liver disease. That's not necessarily true at all. So there's so many things we can do to just be aware of liver health. And that's why I think having these campaigns and these awareness months, should be and to be honest, there's a significant rise in liver disease in general, and so that's important for people to know that.
How can patients and caregivers cope with the emotional side of liver cancer diagnosis?
I think that is so important. And, it is very important throughout this journey to have hope, to have realistic expectations. And it's so hard for caregivers too, because many times they are neglecting their own health, and one of the things in our clinic, and especially with transplant, I always talk to the caregiver, are you okay? Are you supported? Who's supporting you, right? Because most times they're so worried about the patient or the person with the diagnosis and they're not getting sleep, they're not taking care of themselves. So I'm a big fan of advocacy groups. We have so many fantastic advocacy groups that where patients can really get resources, talk to other patients, get the support that they need, because it is not easy to do this alone. And it is hard to talk about this journey. It's hard to really digest this journey and mortality, all these things that come at you so quickly, especially if you were not under a surveillance program or you just kind of incidentally found. So I truly believe that advocacy groups give so much great support and peer support and caregiver support. That's something I really would highly recommend.
Amazing. So, what gives you specifically hope for patients living with or beyond liver cancer today?
Yeah, what I tell everyone, let's just acknowledge this sucks, right? You can't sugarcoat what it is. But if we're lucky enough to find it early, then I say, okay, here are all our options, and these are so many more options than we ever had. If we're not lucky and we found it more advanced, again, like I said, there is so many more treatments than ever before. And especially in both cancers, HCC and cholangiocarcinoma, the number of trials and treatments for these cancers have really exploded. So as horrible as it is to have cancer and to deal with all the emotional and mental distress of it and the physical distress of liver disease, it is a time where research is really peaking and continues to, and where clinical trials are continuing and more drugs are, being explored, and even different types, not just when I say therapies, not just systemic therapy, but local regional therapies and other types of options.